I'm Gigi Engle, certified sexologist and sex educator, and today we're debunking myths about desire and some of the false beliefs we have about it, because frankly, we need to. What is low desire? Low desire is when you're not feeling up for sex, don't have feelings of sexual want for your partner, or simply aren't in the mood. Sometimes this low desire can span over a long period of time, like years. And this can be both frustrating to you and your partner. So, what can you do about it? First, you need to get straight on the facts and myths that surround this condition, because there's a lot of bad information out there that's probably leaving you super confused when you do a Google search. So let's dive in. Myth number 1, frustrating low sexual desire is uncommon. One condition of this is called hypoactive sexual desire disorder, or HSDD for short. Not to be confused with hyperactive, because we're not talking about having a super high sex drive. That would kind of defeat the purpose of this video, am I right? HSDD is a condition characterized by ongoing low sexual desire that is frustrating for women. HSDD is not uncommon at all. In fact, it affects about 1 in 10 US women, some as young as 20 years old. So if you're feeling embarrassed or confused about this, you're not alone. It's much more common than you think. Myth number 2, men want sex more than women. As a sexologist, I personally think this myth is one of the most damaging things for women. Low desire is thought to simply be a woman's lot in life. Hard pass, thank you. In my experience, the desire for sex has nothing to do with gender. Myth number 3, HSDD is the same thing as asexuality. Being asexual and having frustrating low sexual desire are two different things. If you had sexual desire in the past, but lately it's decreased and that frustrates you, it could be a symptom of HSDD. Don't box yourself into a corner because the label feels easier. If your low sex drive is bothering you, get the facts and do something about it. Myth number 4, there's nothing you can do to fix your low desire. There's so many ways to address low desire on your own. The key is figuring out which one is right for you. Have you tried masturbation? Masturbation has shown to increase sexual desire. You know the phrase, you don't use it, you lose it? Well, that has some merit, so grab the vibrators, my pretties. Have you tried getting into a positive headspace? Things like stress, anxiety, and overload at work can really mess with your libido, so check your stressors and consider revising your commitment. Have you tried working out? Working out is a natural and awesome way to boost feel-good chemicals in your brain, like dopamine. This might get your butt and juices flowing right back into bed. It can be easy to blame your age, stress level, family obligations, and responsibilities for your lack of desire, but newsflash, if your desire has left the building and it's bothering you, it could be time to seek medical attention. Myth number 5, low sexual desire that women find frustrating is not a real medical condition. If you think this might be what you're experiencing, talk to your healthcare professional. We know this can be intimidating, but giving up your sex life is not worth it. There are treatment options available to you, you just have to ask. If you need a place to vent and get a good old-fashioned confidence boost before asking your OBGYN for advice, check out Unblush.com. With helpful resources like a quiz to check out your symptoms and an interactive doctor discussion guide, you'll find accurate information to help you deal with HSDD. And it's worth repeating, you're not alone in this. We need to transform the state of stress people have around this topic to strength, and that starts with myth busting. So, let's recap those myths, shall we? 1, frustrating low sexual desire is uncommon. 2, men want sex more than women. 3, HSDD is the same thing as asexuality. 4, there's nothing you can do to fix your low sexual desire. And 5, low sexual desire that women find frustrating is not a real medical condition. For more on Unblush and how you can figure out whether or not you're experiencing HSDD, check out Unblush.com or click the link in the video show notes below. This has been Myth Busting Low Sexual Desire with sexologist Gigi Engle. Thanks for watching.